sterling support to us in the office. And we have Mr. Faisal from UNICEF. Welcome, UNICEF. We are always pleased to collaborate with our sister agencies. So we also have participants online, as I could see, from different countries of the Caribbean. As Dr. Malcolm said, I felt that this is not a subject that Trinidad and Tobago alone and our Dutch territories would be concerned with, but persons from across the region, because we have the Ministry of Health online, and we welcome you, school administrators, principals, and teachers. And thank you to the mental health unit that's collaborating with us here and our colleagues in the Dutch Caribbean islands. This webinar is important, as Dr. Malcolm has said, not only because we're looking at physical and environmental and administrative preparations for return to school. And here in Trinidad and Tobago, it is anticipated that children will be returning to school in September. But we need to also address some of the mental health issues. It's an area that's often overlooked, but it is equally important. And I recall that the Director General of WHO, in one of his interactions with the press, he mentioned that mental health is going to become one of the critical issues in the post-COVID era. And of course, it's something that our own director, Dr. Carissa Etienne, in Washington has recognized. So we are very happy to be able this afternoon to bring together these excellent presenters to share the information, the technical guidance with you, and just as important, to give you, the audience, the opportunity from all across the Caribbean of asking questions, networking with each other, because we're hoping that after this, you actually have a network between each other and you can continue to dialogue, because this is very important. Although we can't physically be with each other, we are so thankful that the technology allows us to continue to be in contact. So I want us to take advantage of this opportunity this afternoon. And as I'm looking here at the top, there are now 244 people on this webinar, going up to 45. So I think it's going to be a very enriching webinar. We probably won't have the opportunity to answer every single question, but I am sure that the questions that are logged, some of them can be subsequently answered. And as I said, you can continue to dialogue with each other. So I want to welcome you again, thank the presenters, and thank you for coming back. We apologize, we had some technical challenges earlier this week, but the fact that you have come back and come back in such significant numbers suggests that there is indeed a great need for information, a hunger for information on how we move forward with the children of the countries of the Caribbean in preparation for the opening of schools, irrespective of when that may be across the Caribbean islands. So welcome again to everyone. Thank you, Dr. Malcolm, for organizing the webinar and setting it up. Thank you to the moderator, which I believe is our own Nicola Taylor here in the office, and all of our colleagues from PAHO, from Ministry of Health, from the Mental Health Unit, teachers, school administrators from here and across the region. Thank you very much, and I wish you a very fruitful and enriching discussion. Thank you very much and good afternoon.
Thank you, Dr. Wheeler, for those remarks. Before moving into the presentation, I would like to note a few housekeeping points. One, to give us an idea of the participants in this webinar, we're kindly asking that you indicate your profession and your country in the chat section. And if you would like a copy of the presentation and the recording, please also include your email address. So yes, the session is being recorded. Your mics are muted, and I'm kindly asking everyone to please keep your mic muted. So if you have any questions as the presentation progresses, I encourage you to submit these in the chat, and we will address them at the end of the presentation in the question and answer session. In relation to the flow, we will take the two presentations, then the remarks from the UNICEF representative, and then we will take all the questions. So As we go along, please just enter your question in the chat. We're taking notes of those questions and we will deal with them in that section designated for that. As I mentioned, the webinar is being recorded and it will be uploaded to the PAHO website. And if you need a copy of it, you just indicate your email address and we will send it to you at the end. So our first presenter for this afternoon is Dr. Eldona Bosson. Dr. Bosson is an epidemiologist serving the Caribbean. She works with the Ministries of Health and other partners to provide technical support to national and regional programs in the areas of epidemiology, surveillance, statistics, outbreak investigation, and the production and dissemination of health information. In recent years, her main areas of focus have been on the implementation of the international health regulations in the English and Dutch-speaking Caribbean countries, strengthening influenza surveillance, and the development of a Caribbean regional field epidemiology and laboratory training program. She has been working with PAHO since 1998, where she still works as an advisor, disease surveillance, and epidemiology. Prior to her work at PAHO, she was employed in the United Kingdom as a research fellow at the London School of Hygiene and Tropical Medicine, and previous to that as a clinical scientist at the Public Health Laboratory Services Communicable Disease Surveillance Center, now known as the Public Health England. At this time, she is also one of the PAHO WHO staff on the Regional Incident Management System team for COVID-19 in the areas of travel and health and surveillance. Dr. Bosson will speak to us on the public health measures to be considered in planning the return to school. Over to you, Dr. Bosson.
Okay, good afternoon, everybody, and welcome to this session. I'm going to take you through more of the physical issues, and my colleague will deal more with the psychosocial. Are you hearing me thoroughly?
Yes, ma'am.
Oh, okay.
Hearing you clearly.
Very well. So I'm going to first of all go through a little bit of background about what COVID is and how it spread and how you protect yourself. Because I think that's very important to do for people to be able to understand how to do an assessment of risk and what they should do to prevent themselves from being exposed. And then I would move from that into looking at special considerations as it relates to reopening of schools. So first part, what is COVID-19? How's it spread? How can I protect myself? So COVID-19, as many of you probably know by now, is a coronavirus, and the coronavirus is actually a large family of viruses that causes illnesses in animals very commonly, or humans. In humans, they cause mostly respiratory infections. Tara, I think we have some interference. I don't know if you can mute. Yeah? Okay. So some examples of diseases caused by coronaviruses. A common cold, there's about 4 or so coronaviruses that cause common cold. Then you may have heard about MERS some time ago, Middle East Respiratory Syndrome. That is actually still around in the Middle East. There was SARS, Severe Acute Respiratory Syndrome, which came and went within the year and we never saw it again. And now COVID-19. So COVID-19 is the newest one discovered in Wuhan, China in December of last year. We believe there's an animal source, bats, and there's an intermediary animal that is still under investigation to determine what it is. I think somebody still has their microphone open, Tara, because I'm getting interference. I'm not sure if you're hearing it.
I'm hearing it. Please, I have muted all mics, but persons are able to unmute. So please keep your mic muted. Over to you, Eldona.
Sure, thank you. So let's talk about the symptoms first. How do you recognize this? Well, the most common symptoms are fever, tiredness, and dry cough. Less common, but it does occur, aches and pains, nasal congestion, headache, runny nose, conjunctivitis, sore throat, diarrhea in some, loss of taste or smell we've discovered more recently, also rash on the skin among some children, and discoloration of fingers and toes. Those are some more recent discoveries. Now, a lot of these symptoms should sound very familiar, very similar to the symptoms you get with flu. Despite what you may see on social media, symptoms usually start mild and gradually build up. People don't suddenly become hit with the disease and collapse onto the ground, despite what you may see. Just like with flu, it begins gradually and develops. Now, some infected people will not develop any symptoms and may not feel unwell at all, actually. These persons tend to be less in numbers, but they do occur, and I'll talk a bit more about those in a while. Generally, your symptoms will start on average about 5 days after you have been exposed and infected with the virus. But it can be as early as the day after, 1 day, within the day, and as long as 14 days after that you develop symptoms. Hence the reason why you keep hearing about 14 days isolation, 14 days quarantine, because it may take that long for you to see the symptoms. Tara, perhaps you need to mute again, and then I'll just unmute myself when you do. Okay, I think we're okay. Most people, about 80%, will recover without needing any medical attention. About 14% will become severely ill, some with difficulty breathing. About 6% of persons who are infected will require critical care in an intensive care unit. And the percentage of deaths, what we've been finding, varies by population. If you have an older population or a population that has more persons with underlying conditions, you may find a higher percentage of deaths than a younger population, for example. So by and large, the majority, about 80% of people will get this disease, will just recover. Those who are at risk of getting more severe disease are older people and those with underlying medical conditions like high blood pressure, heart problems, lung problems, cancers, diabetes. Now, this is not to say that children cannot have severe symptoms, but it is not as common. And the reason being why some people get more severe symptoms than others, when you become infected, the virus is first of all in your upper respiratory tract, and it will cause things like your runny nose, coughing, and so forth. But for some people, like those older people, those with underlying medical conditions, it will descend into the lungs where it will multiply and fill the lungs and therefore deprive your lungs of being able to get oxygen. So anybody who has a fever and or a cough associated with difficulty breathing or shortness of breath or chest pain or pressure on the chest should definitely seek medical attention. Getting into looking at risk. How is COVID-19 spread? Well, it spreads from person to person through small droplets from the nose or mouth when a person with COVID-19 sneezes or coughs. It does not carry in the air. It has to be contained in the respiratory secretion. So I'm speaking of the saliva, what fluid you may cough out when you sneeze, the fluid that comes out. Certainly, if you have persons who are spitting out when they speak, as we used to say in school, throwing boulders, yes, it can carry in the saliva. So it is in those fluid secretions that it is carried, and it does not continue to carry in the air. The droplets are relatively heavy, and so they carry about a meter away before they fall to the ground or whatever is the nearest object or surface. Therefore, people can get COVID-19 in 2 ways. One, they can actually breathe in the droplets from somebody with COVID-19 who coughs or sneezes out the droplets. This is why it is important to stay at least a meter away from sick people so that the droplets will fall before that gets to you. The other way that you can get COVID-19, which is the more common way if somebody is asymptomatic and infected, which means they're not coughing and sneezing, they have no symptoms, is if someone were to touch a contaminated object or surface and then touch your eyes, nose, or mouth. The virus can only enter your system and infect you and make you ill if it makes contact with the respiratory secretions of your eyes, nose, and mouth, the liquids from those three areas. Therefore, if somebody had COVID-19 and had no symptoms, or had symptoms for that matter, and somehow on their hands they got fluid from their eyes, nose, or mouth, and then they touch your desk, let's say, and then you touch your desk, sure, the virus can be on your hands. If you do not touch your eyes, nose, or mouth, and you wash your hands before doing so, the virus is actually very fragile, and soap and water will break down the envelope and make it unable to infect anybody. However, if you don't wash your hands before touching your eyes, nose, or mouth, and it has the virus on it, then you can become infected. So those are the two ways: breathe in those liquid droplets and touching contaminated surfaces, and then touching your eyes, nose, or mouth. So some reports have shown that COVID cases with no symptoms can transmit the virus. It's not known how often this happens, but by and large, most people will become infected by somebody showing symptoms. Those who do not can transmit in this indirect way through touching. Of course, you can have direct transfer of the virus. A common way in the school environment would be if we have children who are sharing utensils, or one child taking a sip of a drink of somebody else's. I guess in the secondary schools and in universities, open mouth kissing as well, once you have that exchange of respiratory secretion. So also, ever since this outbreak has started, WHO has been assessing and doing ongoing research on the ways in which COVID is spread, and advising, and will advise if there were to be any change. Why is it not moving? Okay. Treatments and vaccines. Currently, there's no vaccine and no antiviral medication to prevent or treat COVID-19. How long will a vaccine take to develop? Could be 12 to 18 months as a best case scenario. But there's a worst case scenario. We have many viruses for which there's no vaccine: HIV, dengue, Zika, chikungunya. Dengue, it's not for lack of trying. They've been researching for decades. So there's a possibility there may not be a vaccine. There have been others where we have had vaccine, like H1N1. So maybe there will be. Time will tell. We have no antiviral medicine like Tamiflu for influenza. However, all is not lost. Persons are treated to relieve their symptoms. The same is true for dengue. There is no vaccine and there's no cure, but we know how to treat the symptoms so that people do not have to die from dengue. In the same way, healthcare providers know how to treat the symptoms of COVID-19. And this is why the earlier you seek healthcare, the better it is for you, because it is easier to treat earlier in the infection than later on when the disease has progressed. So this is why if you have serious illness, you would have to be hospitalized, and even those hospitalized, most will recover with supportive care. And of course, there's investigation and research ongoing for the development of a vaccine and treatments. So how do you protect yourself? Very important, because when you assess your risk based on how you know it spreads, you need to know what to do. Well, the most effective ways to protect yourself and others against COVID-19 is: one, frequently wash your hands with soap and water or alcohol-based hand rub with at least 70% alcohol. Why? The virus is fragile, and that envelope around the virus, the outer coating of it, breaks down with soap and water or alcohol-based rub, and it is then ineffective. Maintain a distance of at least 1 meter from people who are coughing or sneezing. Why? You want to evade those droplets. I know in some countries, ministries of health are advising 2 meters. That is totally within the recommendations because we're saying at least 1 meter away. Some are saying go a little bit more, bearing on the side of caution. Of course, if you're ill, cover your cough or sneeze, either with the bend of your elbow or with a tissue, and throw your tissue away. Stay home if unwell. If you have cough, fever, difficulty breathing, seek medical attention as soon as possible. And stay informed on the latest developments from reliable sources. There's a lot of unreliable sources, and I would caution you to look at reliable sources to get your information. So moving on to the considerations for reopening schools in the context of COVID-19 now. Bear in mind, you know how it spread, and you know the main ways to protect. So just one slide to talk about COVID-19 amongst children specifically. So far, what we're seeing is that there's far less cases reported that are children than adults. The vast majority of cases everywhere globally so far has been amongst adults. This is not to say children cannot get it, but they have been in smaller number. Also, generally, children have mild disease. We have had some rare occurrence of critical illness. The role of children in transmission is still unclear. There's been a lot of things circulating that children are super spreaders and these types of things. None of that is clear just yet. Still under investigation. There have a few educational institutions that have had COVID-19 outbreaks. But what we've actually found is that in most of those cases, the transmission was primarily linked to social events that the school or university was having, and not linked to transmission occurring in the classroom setting. And studies suggest that the introduction of the virus was actually by adult staff members to begin with. So that is the information we have thus far. Bear in mind, this is an evolving situation because this is still a new virus. So let's look at risk assessment now. When you decide, or when you are guided by the ministry in terms of what you need to do to protect yourselves, staff, students, other members of staff in the school environment, you must consider your local situation and the epidemiology. In other words, do you have community transmission? Or do you just have sporadic cases? Or only a few small clusters of cases? The decisions you make and that the healthcare authorities would advise you will differ depending on where you are in your outbreak. All the Caribbean countries are pretty much either somewhere between only having imported cases or sporadic cases or few clusters. There is not widespread community spread in any of the countries. And so we're in a good place at this point in time. Of course, we cannot drop our P's and Q's because borders are opening. There is still widespread community transmission in other countries, and we can have reintroduction into our countries. Therefore, while we're in a good place, it is possible that there can be movement. And if that is the case, you will find that the guidance that you get from your healthcare authorities will change. You should therefore not be relying only on school measures as your standalone interventions. You have to consider that the persons who come into your school environment live in another environment. They live in households, they live in communities, they interact with other people going to the groceries and stores and doing their day-to-day business. So you know what you're doing in your school environment, but you must consider that in the context that you're living in a much wider environment and consider what other interventions are happening outside. In your environment, you need to do a risk assessment for the different parts of your school facility, as well as for the different activities in and around the facility. Transport to and from, sporting activities, social activities, and so forth. And you must therefore match your measures to reduce risk to the level of risk. So you want this to look and see, is this a very risky activity? Is this a very risky place? and match what you put in place to the level of risk. And you want to maintain, very importantly, the prevention and control measures that have been advised by your local authorities. I know all countries, there's been ongoing advice in terms of physical distancing and hand washing and so forth. All of these must be maintained, of course. So let's look at hygiene. What needs to happen in the school environment? So now moving to the school environment where you have some more measure of control. You must provide sufficient soap and water and/or alcohol-based rub. You can have a combination of the two in different places throughout your facility, at your school entrance, classrooms, particularly the entrance and exit to the classroom, bathrooms, lunch areas. Remember, in the lunch areas, hands are going to be going to the mouth, which is where the virus enters. So all persons should be washing hands before eating and so forth. These are things that are not so unfamiliar to us. These are the things that we've been taught growing up about washing your hands before eating, after going to the bathroom and so forth. We are now expanding that a little bit more. Additionally, you want to provide bins throughout the facility. You will see the little icon I have there is a step bin. You preferably want to have a bin with a cover so that if anybody needs to throw anything away like tissues, it's not blowing around. Now, if you have a cover, you also do not want to have one that people have to keep lifting up, because then that becomes a high touch area. And if a contaminated little hand touches it and then somebody else does, their hands can become contaminated. So you want to use a bin that is no touch. You want to encourage frequent hand hygiene throughout the day. For younger children, perhaps you can use a schedule to tell them that you must wash your hands at specific times of day, before you do certain things, after you do certain things. So they have some cues that they have to remember. You want to encourage covering your cough or sneeze with your bend of your elbow, and then throwing away your tissue. Definitely promote not touching your mouth, nose, or eyes, because then even if the hands become contaminated, if you don't put them to your nose, eyes, or mouth without first washing hands, you would not be able to be infected. Environmental cleaning. So you want to clean and disinfect. What do we mean by those two terms? Cleaning means that you are moving away contaminants, a lot of organic material from the surfaces. And you're doing this so that when you disinfect, disinfection now means killing pathogens. But if you have contaminants, layers of dust and grease, and you disinfect, that will prevent the disinfectant being able to get to the surface and to actually kill the microbes that are there. So you first want, when you clean, to clean with soap and water or detergent, and then disinfect, to wipe down with your 70% alcohol or 0.1% bleach. When do you want to clean? Obviously, your school facility. Paying special attention to frequently touch surfaces. You will know better than me which those are in your particular facilities, but some common ones: door handles and knobs, railings if you have stairs, desktops, toys in junior schools, school supplies, light switches, door frames, play equipment, and I'm sure you can think of others. You also want to focus on your gyms, sport facility, changing rooms, and those will need to be cleaned even more frequently, because there you will have a lot more hands on sports equipment and so forth. Garbage, of course, ensure daily removal and safe disposal. And if garbage becomes filled during the day, you need to dispose of it more frequently than daily. Cleaners need to wear their adequate PPE, their heavy gloves, their closed shoes. I'm sure they know what they normally use. And if you're using a disinfectant solution, I'm sure cleaners know, but also just in case somebody during the day needs to disinfect, you need to make sure that disinfectant solutions are prepared and used according to the manufacturer's recommendations, both in terms of the volumes used and how it's diluted, and the contact time, how long it must be in contact with the surface. And all solutions come with these instructions. They should be prepared in well-ventilated areas, so there's not a lot of inhalation while preparing. And it's strongly advised to avoid combining disinfectants. Sometimes if you combine disinfectants, you get reactions that may cause adverse effects to the persons who are using them. Physical distancing suggestions for the school environment. Well, as I've said, at least 1 meter apart, so it can be more. Places you want to consider, your classrooms. So how will you put your desks to make sure persons are at least 1 meter apart? Your lunchrooms, how will you structure your lunchrooms? School vehicles, if you have school buses and so, are you going to have to consider not having full capacity to be able to maintain those types of distances? Tutorials in universities, how you make sure the tutor and the student maintain their social distancing. When you consider breaks and lunch times, that becomes a little bit more challenging because they're not seated in particular positions. So you want to consider what is the objective here, keeping people physically at least 1 meter apart as much as possible. So you might want to consider staggering the times, so you do not have as many persons out at the same time. Having lunch at desks, using different locations, different parts of your facility. And again, these are not prescriptive because it all depends on your facility and what can apply. So if you have different locations where different groups can take their breaks and lunches, again, that helps to have less people in one location. In secondary schools, universities, where you normally may have students moving from one class to the next to go to a different subject, you may want to consider have the students stay in class where you already have them separated and instead have the teacher move around. So that is one person moving around rather than several who may then be bypassing each other. You also want to arrange some sort of order for classes to enter and leave the classroom. So you do not have this bunch up of persons, whether it be alphabetical, and then you can have some physical distance in lines so that they space themselves out. And also entering and leaving the compound. You do not want persons bunching up when they're entering and leaving the compound. I would suggest that you tell parents that they refrain from coming in and out of the school. That reduces the numbers. You may want to also consider operating a shift system. May I ask Nicole Lucas to mute their microphone? I'm getting a little feedback. Thank you. So you may want to consider operating a shift system, whereby you can do this on different days. You may consider something like certain children come to school on some days and others on different days. So you reduce the numbers, or different times of day. So some come at maybe the morning and another batch in the afternoon. I know certainly in Trinidad and Tobago, there used to be that type of shift system in some of the secondary schools some time ago. I won't say how far back to give off my age, but that used to happen and children used to learn. So again, I can't be prescriptive, but you know the numbers that you have and what may be possible. And if you do that type of thing, you can also consider a combination of face-to-face and online classes. So maybe while some are in face-to-face, others are having online classes. That all depends on your capacity, your human resource among staff, and so forth. So these are all considerations and suggestions for your particular facility. And when you come to your non-classroom settings, again, as I said, a bigger challenge, your phys ed classes, your sports, your playgrounds, your pools, you need to think again, what am I trying to do? I'm trying to keep people apart. And so how can I limit my risk of exposure or direct contact? In pools, you can think about having lanes, children swimming only in one direction. Bear in mind, in pools, the pool itself is chlorinated, which gives a level of protection. The virus doesn't survive there. But outside, where they have to change, you don't want them gathering up together to change. So you need to think about that. Where and how will they change? When they get into the pool, you can determine it's a little easier to funnel in lanes. In playgrounds or in sports or phys ed classes, you might want to consider, okay, which sports do we do? Which ones can we start first that have less contact? Playgrounds, again, certain play areas for smaller groups of students may be a way to reduce contact. Suggesting particular games that require less contact. In one country, they even had a kind of playgroup system. A certain number of kids are allowed to play together. And so that way, at least if one person becomes ill, they only have this 4 or 5 or however many they decide that they need to do contact tracing with, because the rest have not been in direct contact. That has its challenges, because, you know, what if your best friend is not in that group? But again, these are suggestions. You will know best what can and cannot work in your environment. Management of ill people. Well, first of all, you want to make it clear ill people should not come to school. Students, staff, whoever. But all persons who maybe come in, and let's say you have an asthmatic person, they cough. If they're going to come, they have some reason to explain their symptoms, I would recommend that you let them come with a doctor's certificate, whether it's their GP or so on, or doctor's letter stating the person is asthmatic and these are symptoms they may exhibit from time to time. Because it would not be practical to say no asthmatic children can come to school, for example. Other than that, all ill persons with COVID-like symptoms should not come to school. Now, you can consider temperature screening, but that has limitations. Limitations are when you do temperature screening, it tells you if somebody has a temperature now at the time you screen. It does not tell you if they have COVID. Somebody may have COVID with no temperature. Somebody may be incubating COVID without yet having any symptoms. And therefore, those people you will not pick up with temperature screening. If I take a Panadol before I'm screened, I will not have a temperature if even I have COVID-19. So if you decide to use temperature screening, please do not have a false sense of security. That is not something that you can rely on. It's not foolproof. It cannot tell you if somebody has COVID-19 or not. In addition to which, there's a lot of logistics to work out in terms of who's doing the screening. You also want to think about considering waiving the need for a doctor's certificate. If somebody's saying, you know, oh, particularly staff, you don't want them to think, oh, I have to go to school because I haven't been able to get to the doctor. No, if you, in this time, you want to consider the need to waive the doctor's certificate. Now that may have its own issues, and this is why I put consider, and this is maybe something you wish to discuss within your staff body as to how that can work. Establish procedures for persons with COVID-like symptoms to be isolated. They come to school, no symptoms, but during the day, somebody gets symptoms. How will they be isolated until they leave the facility? These procedures should be for students, staff, teachers, other workers in the school. And that it should also include the procedures for contacting the parent or caregiver and the health authorities that need to be notified. These procedures should be there from before. Where will these persons be put? Who will do the calling? All those details, like a little SOP. Of course, maintain your up-to-date contact information for parents, guardians, health authorities, and universities' next of kin, so that you have this at the ready. Masks. So the World Health Organization, for persons who have symptoms of COVID-19. Why? The function of the mask is to prevent droplets and other respiratory secretions from coming out too far. So those who have symptoms, this is a block. Those those persons caring for ill persons, healthcare workers, other people caring for ill persons or suspected ill persons, parents, and so forth, you can't do that without coming within a meter. So they also need to wear a medical mask. Normally, it's just a medical mask, not a respirator. Respirators or N95 masks, the ones that you're seeing in the with like the yellow strips there, the more cone-shaped ones, those are only used for medical personnel who are doing what we call aerosol generating procedures, like intubations and ventilations and bronchoscopies. These are procedures that mechanically push out secretions further away. So you need the equipment to do that. If I can just ask somebody called administrator to mute, please. We're getting some background. Thank you. So only persons working in hospital doing these procedures should use an N95. Now, I know in many countries, you have the health authorities, the governments have said that you should use masks. And if that is the recommendation from your ministries of health, education, then you must follow those recommendations. I have not yet heard specifically what ministries of education have been saying for persons in school for the full day. I imagine that that will pose a challenge, especially for younger children and certainly even teachers who have to wear it for the full day. This is not really what masks were designed for. And so there can be some discussion in terms of maybe face shields. I can see that it can be challenging to speak to students all day with a mask on. Face shields may allow you to have the child see your face, the student see your face, and maybe be a little bit less restrictive. But certainly you have to use your mask or shield in line with national guidelines. You should maintain a small stock of medical masks, not cloth masks, medical masks for persons who may become ill during the day. If somebody becomes ill during the day, you want the medical mask to make sure you have the maximum opportunity to keep the pathogen in. So just a small quantity for anyone who comes sick during the day. You can always replenish them when they're used. One thing, the reason why the World Health Organization recommends these two categories of persons to use masks is because we have no evidence that says that masks in the general community is either protective or harmful for use. That is the rationale. And we're hoping that countries now that are using masks are going to be able to add to that research and inform. What we do know, though, it is important when you use masks or shields to put them on and take them off properly. Remember, the inside of the mask is touching that nose-mouth area, which is the vulnerable part. So when you take off and put on, you must move from the sides and not touch the inside. And if you do touch the inside, do not put it back on because there may have been contamination. So do inform your students, do be informed that they use it that way. For students, it may be useful to tell them if it is that they have to use masks, they fold it and put it in some sort of envelope or bag, because you want to make sure they don't contaminate the inside of the mask and then put it on their face. That will be counterproductive. Communication. You should inform and routinely update all in the school, students, teachers, tutors, other workers in the school on what's going on. What is COVID? What is it? What's the signs and symptoms? How should they protect themselves? The things I spoke about before. What they should do if they feel ill in school. Who should they tell? Is it a teacher? What should they do? What are the prevention and control measures that you're doing in school now? And why do you have it? Because for you to have them work well, you have to engage the people in the school. They have to buy into it. They have to understand and they have to comply. And so you need to explain and communicate. You should encourage and address the questions and concerns of students and staff and parents. Use age-appropriate means. You can have child-friendly posters on notice boards, for example. Again, you need to have the buy-in. And so if you're not encouraging those questions, remember, many people are very anxious. This is all new. People have been under lockdown. This is a highly stressful time, and I won't go too much into that. So you do need to encourage those questions, alleviate fears and concerns. Work with your counselors, your social workers and school health workers to identify and support those students and staff who may look like they're having signs of distress. Outside that school environment, inform your parents and caregivers about the prevention and control measures the school is putting in place and ask for their cooperation to implement. Reinforce that the parents or caregivers should alert the school and health authorities if anyone in their home has been diagnosed with COVID-19 or is suspected of COVID-19. And if so advised, their child should stay at home. You should also promote non-stigmatization of COVID cases and contacts. So if somebody has been a case and they have recovered, they come back, you do not want stigmatization. This is why communication is important. You also want to remind parents of the importance of ensuring their children are up to date with all vaccinations. Just because COVID-19 is a new kid on the block, it does not mean that the other diseases have gone away. Measles and all these other vaccine preventable diseases are still out there, not all in Trinidad and Tobago, but as we open borders, we can have persons coming in with these things. So we need to maintain those. We also recommend you utilize your existing mechanisms for information sharing. I'm a parent myself, and I get a lot of information as it is before COVID about all sorts of different things. We have parent-teacher committees, you have class representatives who have their WhatsApp groups and so forth. We're very well connected. Utilize what you already have to share information. And always coordinate and follow the guidelines from your national health and education authorities. A few additional considerations. You should be, now I know that it's a requirement for children to be vaccinated according to the schedule in your country before they come to school. You need to ensure at this time that the school entry immunization checks are happening. Don't let it slip at this time, because we have been seeing evidence of vaccination rates decreasing due to the lockdowns, people being scared to go out, to go to health facilities and so forth. So do ensure you maintain those checks. Ventilate your classrooms as much as you can. Assign, another thing that you can think about, assign work and projects for home study. This may be easier for older children, university students, but to some degree for younger students, so that if it is they're not coming into school every day face to face, or they're not doing full school days because you're staggering, you give them something that they continue their work at home. Ensure frequent follow-up and support for students who are out of school, whether it is they are off because they had an ill person at home or whatever is the reason, and avoid penalizing or stigmatizing such students. Work with your social services to ensure you have that continuity of critical services that you normally have in school. Things like your school feeding programs, counseling, health screening. This is a time that those really need to still continue. Something else you might want to consider, I've seen certainly happening here in Trinidad, consider radio and television broadcasts of lessons. This may be something that you can coordinate with your respective ministries of education to have certain broadcasts, and maybe some basic lessons can be delivered that way at specific times, and therefore does not have to be delivered within the school environment. So these are things that you can consider and discuss. Monitoring and evaluation of changes, very important. You're putting changes in place. You need to monitor your school absenteeism rates amongst your students and staff and compare to your usual rates. Because if you find that you have a lot more persons being absent, you need to look into that. Is it that you're having a lot of people who are suspected cases coming up? Or are there other issues? There may be other social issues that need attention, maybe not from you in education, but from social services. Look at the effectiveness of the changes on education. You know how your kids normally perform, or your students. Are you seeing changes? Are some not doing so well? So is it the changes that are making a difference? Do you have to be flexible and make some changes? You need to monitor that the changes you put in place are working for the benefit of education and health. You want to look at the effect of the changes on the health, including mental health and the well-being of everybody. And one way you want to do that is to gather and utilize feedback from students and parents and teachers. Find a forum to encourage that feedback. Maybe Q&A in the class, or open discussion about how things are going. Discussion in your staff meetings, in your PTA sessions. You now reach probably more parents than ever before using your virtual platform. And inform your local health authorities if you're seeing these large increases in absenteeism due to respiratory illnesses. And so that was my last slide. You will have the slide. So I put the key references from WHO here, as well as on the next slide, some key websites. I couldn't put the Ministry of Health website for all the countries because there are so many countries, but you only need Google Ministry of Health of your country to find that website. So the presentation will be shared and you will have those there. And everything I've said will be contained in those in a lot more detail, of course. But in the interest of time, obviously, I try to summarize as much as possible. So I thank you very much for your time, and I hand back over to the moderator. Over.
Thank you, Dr. Son, for such an excellent presentation and for reminding us first and most importantly, how the virus is spread and therefore putting things into perspective. Thanks for also highlighting the importance of risk assessment and for indicating how some very practical measures that can be taken regardless of the institution, whether at the primary, secondary, or tertiary level. Please be reminded to place your question in the chat, as this will allow us to be able to answer more questions during the Q&A section. Please keep all mics muted during the presentation. For those joined after we started, please know that the session is being recorded and we will be emailing it to you along with the recording and the presentation. So please add your email address in the chat. Our next presenter, Dr. Claudina Caetano. Dr. Caetano is Regional Mental Health Advisor with the Pan American Health Organization, and she's based in Washington, D.C. She's a public practitioner and a medical doctor specializing in psychiatry. She received her degree at the Universidad de San Carlos in Guatemala, her postgraduate degree in psychiatry at the McGill University in Montreal, and her master's degree in public health from the University of Liverpool in the United Kingdom. Dr. Caetano will speak on the importance of building mental health literacy in school. So over to you, Dr. Caetano.
Thank you very much, Dr. Malcolm. It is a pleasure for me to be part of this webinar, and I pay keen attention to the welcome that we received from Dr. Wheeler, the PWR in Trinidad. That is a fantastic opportunity to build a network, to be connected, specifically when it comes to this issue, that is not an issue that is for the school opening, that is not only for Trinidad, that we also want to make sure that we extend it to the other islands. So thanks for the opportunity, Dr. Wheeler, that you're providing not only for Trinidad, but actually making sure that other Caribbean islands are involved. And I also particularly like the presentations before, because I think that set the stage to what I am going to be talking to you. So this is my topic has to do with the school, mental health literacy. But before we go into mental health literacy, I'll be talking about some of the issues like with the school closures, the framework for reopening schools, adolescent mental health, effective mental health interventions, what is mental health literacy, and what is the role of teachers in promoting mental health. As we all know, the school closure has been more than 2 months since school has been closed. So this is in more than 190 countries. So we are not alone. This is we know it's a global pandemic. First time that we are all in this situation, we're all in the same boat. I always tell people that we are all in the same boat, although we are facing different storms. The closure affected over 1.57 billion children and youth. So 90% of the world's student population. This isn't big, this is a major issue. So closure happened in quick succession as a measure to contain the COVID-19 virus. So some governments deploy measures for learning to continue using internet-based platforms. Some have been using like radio, some have been delivering work to their students or materials. This is far most reaching experience that people have experienced in the history of education. This is not something that we have experienced before. So what we know when it comes to the status of school closure by country, this is the data from March 2020. It's that you find that they are in different, we still find that a lot of countries, over 136, are still closed. Some are, some are seasonal closures, and some are opening with limitations, and some are the ones that are open are these ones you see in green, which is about 8. Not in our region, so this is important to understand what is the status from other countries. So the state of reopening of the school, when it comes to reopening the schools, the tempo is far more uncertain. According to UNESCO data, 100 countries have not yet announced a date for schools to reopen. 65 countries have plans for partial or full reopening, while 32 will end in academic year to online. So this is for more than, we're talking about 890 million students worldwide. The school calendar has never been so undefined. So I can understand when we listen to these numbers and to this data, this creates a lot of anxiety, this creates a lot of fear, a lot of worry for everyone, not only for teachers, but also for parents, for everyone. So the goal of school reopening during this crisis is not to return to normal. This is not what will happen. The goal is not just to do things differently, but we have to make sure that we're safe. So safety is very important. Capacity is very important. And the presenter, Ms. Eldona, before me, mentioned the importance of doing things in a very smart way. So you have to be able to keep in mind your context, do the risk assessment. So this is very important because here is not, we want to keep in mind that safety is number one, it's our one of the priorities. So just as the most marginalized students are most at risk of being left behind, if we have distant learning modality, they must be the priority back to school strategy. So this has to be important. So when we talk about distance learning online, not everyone have that access. So it's important to pay attention to that. So we must pay special attention to the impact of school closure and the isolation period on the psychological and mental well-being of youth. And it's not just the youth, for children, for adults, for everyone involved. People perhaps are aware that there is a framework for reopening of schools, and this framework, when we share with you the presentation, you'll be able to you can download it and learn more about that. So it's a framework that was developed by UNICEF, World Bank, World Food Program, and UNESCO. So present guidelines in terms of reopening of schools. I'm only presenting to you, and I don't expect you to be reading it, but this is what is important. They look at the sections on well-being and protection, and you focus on learning. When we talk about focusing on learning, the recommendation is that prior to reopening, which is which you already, that was the presentation before me, prior to reopen, you have to develop alternative academic calendars based on different public health scenarios and taking into consideration modalities to be used for remote learning, which means that you may want to have alternate days. You may want, when we talk about, making sure that if you're going to institute physical distancing, that then you have to may have alternate modalities. So this is prior to reopening, have that discussion. Part of reopening process is also important that teachers have to be able to become aware of what it's to deal with both learning, recovery, and students, and the importance of mental health and psychosocial needs. So we use the word MHPSS, which means mental health and psychosocial needs. And when we say mental health and psychosocial, because it's not just talking about, we're not talking about mental disorder, we're talking about mental well-being. So training efforts will be important so teachers can understand how to support students and how to support themselves in terms of being mental, emotional wellness. So that is important. And once the school is open, so what are these considerations that are recommended in terms of to maintain well-being in the schools? And if you look at this pattern part here, is the importance of where this is coming, to increase provision of mental health and psychosocial support services that addresses stigmatization, discrimination, that helps to support children and their families in coping with this uncertainty of the pandemic. So mental health is definitely important and consideration when we talk about the reopening process. It's also important, you were told about conducting a risk assessment, but the risk assessment in terms of the physical structure of your school is very important, but also risk assessment for the teachers and the staff, because as you all know, when it comes to COVID, we know that age, although, when it comes to COVID, age, people with chronic pre-existing conditions, mental or physical, some teachers may suffer from cardiovascular disorders. Some teachers may have diabetes, may have hypertension, may have these non-communicable diseases that makes them to be more vulnerable for COVID. So I think it's important to do the risk assessment of teachers when we talk about this physical, the illness that can make them to be more vulnerable. So this is an approach that you need to be taking into consideration. So I recommend that you look at the framework because it highlights these issues. So other considerations for reopening is that it has been mentioned that you may want to do the surveys to be able to understand what are the needs, what are the fears, what are the issues that are happening, so that the decisions on opening will require countries to quickly gather this information on how schools, teachers, students, and communities are coping with the pandemic. And this is important because it helps you to start to do some preparedness once the school is open. So how learning and well-being can best be supported in each context. So here we're talking about the special consideration of benefits of the classroom-based instruction, and if vis-a-vis remote learning. Importantly, so here when we talk about the impacts of poor, why mental health matters. Mental health matters because when there is a poor mental health, so children don't learn, there is a low educational achievement, they have a high dropout rates, there is an increased health risk behaviors. When we say premature death, as children are, can have more self-destructive behaviors, suicide attempts. So there is a lot of issue with stigma, discrimination. There is decrease in daily life participation. And that also affects, they have difficulties starting with their family, and most mental health needs in your adults, in your youth, are unmet. And even in high-income countries, and most of you know that living in a high-income country, so when it comes to mental health, whether it is a high-income country or a low-income country, mental health is still a low income, it's everywhere. So it's still unmet. It's not because it's a high-income country that everyone is quite happy. It's the opposite many times. So I want to mention to you the importance of understanding mental health, particularly when it comes to adolescents. And this will be, when they're going to high school. So because we know that the burden of disease is significant in the adolescent period. So what we are seeing is that when it comes to depression, for example, is an illness, not a depression as a, when you're depressed and you're sad, no, that's a symptom. We're talking here of an illness, when it's a disorder that it can affect adolescents, and that can lead to suicide. And we know that suicide globally is a third leading cause of death in 15 to 19 years old. So we're talking of 53,000 deaths due to suicide in the year 2060. That's quite high. And we tend to think that suicide is high among boys or men, but it's also high among girls. So it's very important to pay attention to that. And sometimes the attitude is that if someone attempts suicide or someone has thought about suicide, we think they're just manipulating or they're just calling for attention. We don't take this seriously. But it is important to take this seriously because these actually are risk behaviors that adolescents tend to present. So it's important to recognize what are these behaviors because that adolescents may encounter. So we know that they're not limited only to, it could be because of violence, forced migration, substance use, illness, harsh parenting, sexual violence, early pregnancy. All of those issues are risk for mental health problems with adolescents. And an important data that we also have to keep in mind is that we're saying 50% of mental illness begin by the age of 14. And then by the age mid-20s, you have 75%. So this is an important data to keep in mind, the 50%. And what we are saying is that the age of diagnosis of major mental disorders, when you look at between 0 and 5, we're talking about autism, we're talking about attention deficit disorder. By the time they are between 10 and 15, and even 15 to 20, this is where you have most of the mental health disorder. So it's very important that we do prevention and promotion so that adolescents don't have to end up having anxiety disorder, obsessive compulsive disorder, anorexia nervosa. Those are all illnesses that by the age of 20, if you see, they may be happening. So this is what we mean when we say that 50% of mental health problems can happen before the age of 14, and then 75% before the age of 20. This is another table just to show you how the ages here have to do with different disorder, so that by the time they're in the 15, 18, that's when we start to see this disorder like anxiety, substance use, and adult type psychosis. So when you talk about adolescent, when you look at alcohol use, for example, this table, I think it's relevant just for you to look at the importance of what happens in the Caribbean. So in Caribbean, this is where you see a higher level by almost 60% adolescent. And we are talking about age 13 to 15. Almost 60% are already using alcohol. This data comes from the Global School-Based Students' Health Survey. So this is a very serious problem for us in the Caribbean. And unfortunately, sometimes we take it, for granted that drinking alcohol is okay, but then this is a cause for serious problems. Similarly, for suicide, as we know in our region, we also have a higher rate of suicides for both female and male. And these are situations that we need to take into consideration because when one suicide is already, it's a loss of a life, and that can affect, a community, entire family. And even here, we're looking at, but this data has to do, again, percentage of students aged 13 to 15 who seriously consider attempting suicide. So this is a very serious problem, the attempt of suicide, and that's still also an issue in the Caribbean. And important is to remember what are the mental health determinants. The more risk factors adolescents are exposed to, the greater the potential impact on their mental health. COVID also brings its own challenges because the issue of confinement, the issue of quarantine, the issue of isolation, all of these things have a greater impact on people's mental health. And in addition to that, there is these other factors that compound it, that affects your mental health. And when it comes to adolescence, we all know that, the desire for greater autonomy, the pressure to conform with the peers, the quality of life, the exposure to substance use and violence, all of those can expose them. So what are these interventions that we consider to be very important? So we talk about two approaches: the promotion of mental well-being and prevention of mental disorders. Unfortunately, sometimes in our settings, people don't want to talk about mental health because they think of mental disorder. They don't see the value of taking care of their mental health. But then when we talk of promotion of mental well-being, we talk about, taking care of your physical health, taking care, social support, healthy lifestyle. It's not about having an illness, it's about taking care of yourself. It's the prevention. We want to prevent the use of substances. We want to prevent the increase of violence. And this is what we want to be able to focus on, so that people don't have to end up having a disorder if we start to think of promotion on mental well-being. So what is mental health literacy? So the mental health literacy is a program that's available to improve the health outcomes, as I mentioned, of the population, and that we can teach, that can be taught to teachers or to students, and it's best because, literacy, children spend a lot of time, sometimes up to 30 hours a week in school. So ideally is to be taught in schools. As I mentioned before, we thought building literacy will help to decrease the outcome of having disorder, because we're looking for early identification of mental health problems. We're saying that by the age of 14, you have 50% of mental disorders that are diagnosed. So it's very important to consider doing that at school. So it's a skill that can be used for himself, for family, for friends, of others. It's a foundation for health promotion, prevention, and ongoing care. That's what mental health literacy. So what we're looking for is the 4 components of mental health literacy: is understanding how to obtain and maintain good mental health. Just the importance of maintaining good physical health, when we talk about healthy diets, sleep hygiene, good, exercise, definitely very important to maintain good mental health. Understanding and identify what are the mental health disorder, and the treatment will help to decrease stigma. When there is less stigma, people are more open to seek help. So enhance help seeking efficacy, know where to go, when to go, and know what to expect when you go there, because this will increase the likelihood that they get a better service, that they get treatment. So we're talking about early identification, early treatment. So it's building the skills and having tools to take care of themselves. That is what is mental health literacy. So what is the foundation for the literacy is, when you look at this pyramid, first is that we become literate in understanding what are the steps in taking care of ourselves. We want to work on health promotion, on health prevention, and much to understanding about treatments and understanding about care. So who needs mental health literacy? Well, when you think about it, everyone. Here we're talking about school mental health literacy. So we're talking about students and teachers, service providers, other school support, school administrators, health providers, parents, media, the wider community. The better we are in terms of understanding mental health literacy, as I mentioned before, so there is an increase in health-seeking behavior, there's a decrease in stigma, which is what keeps people suffering in silence because they're scared of being stigmatized. So this will be able to make it easier for people to seek attention. And what is the role of the teacher when we talk about the school mental health literacy? Is to promote mental health well-being, is to be able to recognize when problems arise. And this could become a challenge, specifically when you're thinking of when we're doing face-to-face teaching, then the teacher is there to be able to see the students. And you know that it's different when you're doing online, because then you don't know what the student is doing. So this is, I think, another challenge that we'll be experiencing now with COVID. But yet the idea is to recognize their performance and see what is happening, how the child or the adolescent is doing. And again, if there's a need to refer, where to refer the adolescent, and what if there's health systems that can support them. and their family. So the idea is for the teachers to work effectively in the classroom with the other professionals to support, not to do counseling or therapy. The teachers are there to teach. We're not expecting them to be doing therapy or counseling, but it's important that they know where to find help, where to go, what to do. They're not there to prescribe or suggest a specific treatment. They're there to provide the guidance to parents. And this program, this mental health literacy program we have done through PAHO, we have done some training in Belize, in Bahamas. One of the trainings that we did in Belize, we invited some health providers and school and teachers from Jamaica, as well as Trinidad and Turks and Caicos to Belize when we introduced the mental health literacy. Currently, Jamaica is doing a virtual training, but the face-to-face training, we did it in the Bahamas and in Belize. And as I mentioned, this program is targeted to 12 and 15 years of age, and it has 6 modules. So what is important to keep in mind is that when we do the school mental health literacy program, we want to make sure that the teachers are not there to diagnose. We don't want teachers to diagnose. We want teachers to train. Diagnosis of mental disorder should be done by psychologists, by by psychiatrists, by mental health professionals. So the teachers should, what we expect from the teacher is for them, we want them to know what they're seeing, what is the issue that they're more concerned. The idea is for teachers to help the students to be able to take care of themselves, to understand when to seek help, and to also be part of the reducing of stigma. So this is the goal, not for them to be doing diagnosis, because mental health professionals will be doing that. I want to end my presentation by having the slide on another tool that we use. So when we're doing the school literacy, this program, we also want to make sure that in the country we have healthcare providers that are capable or have the skills to be able to understand this child and adolescent mental health behavior, how to treat kids. Most times most of our countries don't necessarily have specialists or psychiatrists that are child adolescent psychiatrists. So it's very important that the frontline health workers, the primary healthcare providers, are equipped to understand how to do an assessment and diagnosis of mental health problems. So we have a tool called MHGAP, Intervention Guide, which means mental health global action program. So it's for primary care providers, for doctors and nurses to learn to be able to do an assessment, to learn to be able to understand what are the different, when they do their assessment, what are the different behavior, what are the different disorders that they should consider, how to manage them, and actually if they need to do psychosocial intervention, and how to do that. Because this is, as I said, specifically for situations where there is limited professionals. So with that, I end my presentations, and thanks for the opportunity to present this information to you.
Thank you, Dr. Caetano, for such an informative presentation and for sharing some of the possible challenges to be anticipated, some of the impacts that poor mental health may have on individuals, and the importance of building mental health literacy in an effort to optimize and maintain good mental health. I am sure you would agree that these were two excellent presentations and that they have provided information that will be useful as you move forward. I know you may have some questions. I see the questions coming in the chat. But before we go to the Q&A section, and to help lay the foundation, we have a representative from UNICEF that will indicate some additional resources and information that may also be helpful as you move forward. So Mr. Fias Shah is the education manager for the UNICEF East Caribbean Area Office since December 2019. He has been with UNICEF for over 13 years, serving in various capacities in several countries, including Pakistan, Syria, Kenya, and Iraq. Mr. Shah will speak briefly on some of the support that UNICEF is providing and resources available to assist schools in implementation of some of the measures outlined. So over to you, Mr. Shah.
Good afternoon. Thank you, Dr. Malcolm, Dr. Miller. Good afternoon to all the distinguished participants. I had prepared a presentation, which I'm happy to say most of those areas on the school opening framework and mitigative measures were very well covered by Dr. Boyson and Dr. Saitano. Therefore, it allows me an opportunity to discuss one of the most important area for which we go to school, which is learning. So I modified my presentation slightly. See if I can share one slide. We can maybe discuss the learning aspect of the impact which COVID has made. Are you able to hear me?
I'm hearing you clearly. Someone named Shellyan, please mute your mic.
Okay. This slide is just part of the same framework.
Policies, procedures, and financing plans.
Someone has their mic open. Please, Janelle. Go ahead, Mr. Shah.
Yeah. Well, I was referring to the same framework which previously was mentioned. And I'm just going to highlight one area in that because most of that was discussed and all the preventive measures were also discussed in very brief. I mean, schools, we know they are the most viable government institution in any country. Wherever you go, the one government building institution you see is school. And schools are the school system is really which provides access to most of children. But I want to discuss the impact of COVID on children. It is mentioned in the framework, and UNICEF has shared the framework with all the ministries of education where we work with them. And we are happy to support and assist the ministries in implementation of the framework during prior to reopening of the schools or during reopening as well as while schools are open. So most of the measures were discussed in detail. But one area which we really need to focus is children who already were slow learner or who were unprivileged or who were behind and vulnerable already. All the research shows if they miss out certain time from school, they are unlikely to come back. So we must make sure during the reopening, we get those children back to school. This is one area. It's not just getting them back to school, it's reintegrating the marginalized out of school children and also making sure that the education component they missed during schooling, that is somehow they are provided with catch-up opportunity or some remedial education, because otherwise they will certainly drop out. Only in Trinidad and Tobago, when online education opened, ministry estimated that 60,000 children did not have access to devices to access the online education provision. So that's a huge number we're talking about. Out of 250 approximately 60,000 children did not have access because they did not have devices. So similarly, the better off children, they somehow get some kind of education through online and without online support, with their parents' support. And in new approach, when we reopen the schools, many schools will be encouraged to have blended approach, meaning use of technology and some lessons to be taken place at home or remotely. Again, these children are the one who will be kept apart, and they will not be able to be with their peers, and therefore their risk to drop out will increase. So I think this is, as teachers, as education planners, this is one of the area that we do promote equity in learning. We do find ways how to make sure that all the children benefit from reopening, and all the children benefit from blended education. And of course, when schools reopen, health, hygiene, and all those measures, they are for all the children. But learning will differ for all the children, because learning is something which is individual based, which will require extra efforts from the teachers. So I'm emphasizing on this one because this is one of the area in previous presentations. I thought most things were discussed in the previous presentation, and this element was sort of we needed to emphasize more. So I don't want to go more discussing on the importance of this, because we all know how important it is for all children to learn. Therefore, society can progress. But I would like to take this opportunity, since we have so many people online who are on the front line in education, who are teachers, who are going to deal with these students, who's going to deal with reopening of school, whose own life will be part of this new normal education system. So I would like to see what difficulties they think we who support provision of education, who support delivery of education, what are the areas we should be concerned about in our reprogramming. Because in our programming for support to schools, in our programming for support to ministries, to teachers, to parents, what should we be considering that you as an frontline educator will face difficulty in reopening of schools? So I want to leave this question, but in addition to this question, I also want to emphasize, of course, UNICEF will be supporting UNICEF and its all partners, including PAHO and other organizations. We will be supporting implementation of the reopening of schools framework, and any support needed for the ministries and other education partners, that we need to learn more about it, because so far it's a evolutionary situation. Everything is evolving. We have some ideas, everybody is thinking, but when it comes to practice, we need more inputs from all of you who are online, that what should be considered more on our part for programming to support you. But from my side, the message is we really need your support to make sure those children who are left behind during school closure and who will have less chances to access education during blended education or a new normal situation, how those students are brought together with their peers. So I close here and open for maybe discussion, or maybe give back to Dr. Malcolm to guide us through.
Thank you, Mr. Shah, for speaking to the importance of reintegration of marginalized children and encouraging the blended approach as we move forward. I will now hand over to Ms. Nicola Taylor to moderate the Q&A segment. Over to you, Ms. Taylor.
Good afternoon, everybody.
This Q&A session is very important for us as we're hoping to address as many concerns and questions as possible. So because we have a little bit over time, I will move very quickly into it. There are 3 questions that I'm going to target towards Dr. Boisson. The first one has to do with the temperature, in somebody's temperature. What guarantee is there that a student will not catch the virus even if the person is normal at that point in time? The virus. I think
Sorry,
somebody's
Miss Taylor,
mic is
sorry.
on.
Somebody, Mike.
So the first, Dr. Boisson, has to do with the temperature, taking somebody's temperature. I'll just actually go to the second question, which has to do with the face shield. What about
Miss
the
Taylor,
option?
we're not hearing.
Sorry. Yes. And I think the mic is open. Somebody's mic is open. Can somebody mute? Can everybody mute the mic? Okay, is this better?
Yes. You can go ahead now, Miss Taylor.
So, Dr. Boisson, I'm going to actually pose 3 questions because they came in right after your presentation. The first one is, what guarantee is there that a student will not catch the virus even if their temperature is normal at that time, but may later catch it? That's the first question. The second question that I'm also going to ask you to answer is, what about the option for students to wear the face shields at school instead of using masks? I know you mentioned it briefly in your presentation, but the concern is that children are very naturally restless and may find it difficult to adjust to the new normal. So if you could go ahead, Dr. Boisson, just respond quickly to those 2 questions.
Sure, certainly. I wasn't completely clear about the temperature question, but if I understand correctly, the person is asking if somebody comes in without a temperature but still has COVID, can they pass it to other persons? Is that the question? Was it clear?
I think it's more about if they have the normal temperature, but they may also catch the virus later on.
So they don't have a temperature, they don't have the virus, and can they catch it?
Yes, later on.
Absolutely, yes. I mean, having a temperature is just one of the symptoms of COVID-19. It doesn't mean that absolutely everybody who has COVID-19 has a temperature either. So you can have somebody with no temperature who is a case or who's not a case. You don't have to have a temperature to become a case. Does that address the question?
I think that addresses the question. The other question had to do with the face shields. I know that you touched on it briefly. Could you give a little bit more information about the children?
Sure. So the issue with masks versus face shields, masks were not really designed for persons to wear for hours at a time, especially in the external environment that we live in, which is quite hot. I mean, certainly for an N95 mask in a hospital, they do not recommend more than 6 hours use. And once it becomes damp, then it should be removed because the dampness compromises the effectiveness of the mask, okay? I'm seeing at the same time someone asking about cleaning and reusing masks. If you're using a cloth mask, you can wash in your regular soap and water, and that will disinfect the mask. That will be fine, and it can be reused. The concern with masks with children is more than one concern. One, the length of time they're wearing it. If they have it all day long, they're going to be taking it off during the day. They're going to take it off to have lunch. They're going to take it off to have their breaks. And so then you have the challenge when they take it off, the potential contamination of the mask. Because the last thing you want is they take it off, the inner surface of the mask becomes contaminated when they put it down or something, and then they put it back on their face, touching the most vulnerable area. So I can certainly foresee challenges with children using masks, particularly younger children. And even with the face shield, it's a bit easier because they are less likely to be handling it. And they can see each other, which I think is important. But again, when they take it off and they put it down, there needs to be clear criteria where they are. They don't want to contaminate the inside. I think it will be important to be guided by the national authorities, because if there are national authorities, ministries of education or health, saying that a mask is to be worn during the day and you have concerns, I strongly suggest that this be a discussion with the authorities to look at alternatives. I know, for example, in Trinidad and Tobago, the Ministry of Health has said they will not be having children doing CSEC and CAPE. They will have them physical distance and they will not use masks. At the end of the day, the key thing is you want to prevent children, students, or anyone in the school environment contaminating themselves or being contaminated by others. So think of it as a package: physical distancing, hand washing, not touching your eyes, nose, and mouth. Masks are part, or shields are part of that. But if you think about it, and you can have a situation where they can be physically distant, they wash their hands frequently, you get them to comply with not touching their eyes, nose, and mouth, then it becomes less important to emphasize the mask. So let's say they're physical distance and they come and they sit at their desk, and you know the desks are clean. Until they move from that desk, then there may not be a need for them to have on the mask, because they have already gotten that sort of bubble of protection around them. So these are things that you will need to discuss, because I'm not aware of every single recommendation in every single country. But certainly I can foresee challenges with children using masks for a full day. And if masks become damp, they become compromised and they're not effective either. So these are discussions to be had depending on what are the recommendations that come out. Over.
Okay, so following on that information, the other question was about what special measures should be put in place for children in the early childhood classrooms, 3 to 4 years old in particular. And there's another comment related to that. Some children will use different materials in schools. And how do we prevent contamination in the classroom with these small children who play with different materials like puzzles and blocks, etc.?
Yeah, that is a challenge. And I think it's going to be a new norm where there would have to be some separation of children. So yeah, so the young children, they will have blocks and other play toys. It would be necessary on a daily basis to clean those. It may not be so easy to do it during the school day, but I think each child will have to be using one set of equipment and not sharing equipment. If that is absolutely not possible, resources do not allow, then you want to limit the number of children that use the same piece of equipment. So remember, it's always about creating that sort of bubble of protection. You want as much as possible to have as little number of people in that bubble. So if you don't have enough supplies and you have no choice and there must be sharing, you don't want everybody sharing. Limit the number who share, but as much as possible, one child using one set of equipment and having them cleaned at the end of the day. If it's possible to have cleaning during the lunchtime break or the breaks, if you have the resources, that is another option. With respect to children, young children, 3 to 5, that's certainly a bigger challenge than the older children. And you're going to have to take measures to probably have more, maybe indicators in terms of where you want them to be and not be at different times. Indicators along the walls, along the floors, because it will be less easy for them to comprehend a meter away and that type of thing. I'm not sure if that answers the question. Over.
Thank you, Dr. Wasson. Now, Dr. Cayetana, I have some special questions for you. You had mentioned that some critical information should be gathered before the reopening of schools. That's one. But the other two questions also relate to resilience. How do we teach children better coping strategies? And what are some things a teacher can do to assist students in creating balance and for them to get a better understanding for being more resilient? Dr. Cayetano? I think Dr. Cayetano had to go to another session, but what we will do is send you some additional information on coping strategies and resilience so that we can send the information to you once you have given us your address, which most people have done. The other question then goes on to, I think Dr. Vasson, you can answer this one, the use of the AC, air conditioning in the classroom.
Sure. It is possible. You have your AC filters. You need to make sure that they're properly serviced and functioning well. As I said before, the virus does not carry in the air. Okay, the virus doesn't carry in the air. So if your filters are working well, you can have your AC on. However, you need to listen to the advice of the national authority, because it may be in a particular country they say no, do not use the AC, and that may be because they are party to some information, such as they know that the filters are not able to be routinely cleaned or something like that, which we wouldn't necessarily know. But certainly you see in offices, you see in other places, in hospitals, you have AC as long as they're functioning well. So from a scientific point of view, there is no reason not to. That's part of being well ventilated, but there may be other extenuating reasons why your national authorities may say no AC and to keep windows open. Over.
Okay, thank you, Dr. Vasson. And then I have just two more questions coming up. One, if we could go back to some suggestions as to how you can do social distances when your classroom has more than 20 children per class, and what could be recommended if the school is really packed or the classroom is really packed. That's the other question. And I think you addressed most of the other questions that are coming up now, the mask, and the last one would be, if one child gets COVID-19, should this whole school be closed down?
So what was the first question? So well, let me do the last one first. If someone gets COVID-19, should the whole school be closed down? Not necessary. If you are putting your measures in place and you have persons physical distancing, then you only want to do contact tracing. You want to determine who was in contact with the child. So let's give a practical example. You have a classroom, and you have in the classroom, there has been social distancing, and you have one teacher. And you find out that later on in that evening, the child had become sick. Then you would need notify your health authorities, and they would need to come in and have a discussion to see who was exposed. Exposure means being less than 1 meter away from the child. That will probably require some discussion with the teacher to find out when they were in the class, what did the child do for the day? When they were in the classroom, was there any activity where they were moving around? Who was the child interacting with? Did the child go into sporting activity? Did the child interact with other children in a project activity? Were they in the same play area and they were not physical distancing? And it would be those persons, students or teachers. Did the teacher have to come and give the child some hands-on assistance, and so therefore was within the 1 meter? Those will be the persons that then, after they have discussed and found out who was within that 1 meter bubble of the child, that would be considered a contact, and that contact will then be required to be quarantined. But certainly not the whole school, because remember, as I said, it doesn't just carry in the air. And again, at the end of the day, you're cleaning your school, cleaning and disinfecting on a daily basis at the end of each workday as well. So even if the child used the desk that day, they would have it cleaned the next day. The first question, I recall now what you said in terms of the number of children in the classroom. Remember, you need to maintain that physical distance of at least 1 meter away. And in some countries, I know schools have been told 2 meters away. And if that is the case, that is what you need to adhere to. If that is the case, you then have to have discussions as to how you're going to facilitate that. So if your classroom currently holds 20 students and they are not 1 meter away, at least, or 2 meters if this is what is being said in your country, you have to see how many children can I accommodate in this class, maintaining the required physical distance. And then you have to consider, how am I therefore going to have teaching for all? So let's say your classroom can hold half the number of students. What am I going to do? Am I going to have staggered teaching, half come in the morning, half come in the afternoon, or half come certain days and half come other days, a mixture of online teaching as well as face-to-face? If you can only hold a quarter, it's the same thing. How will you have to maintain the physical distancing. How will you do that? With blended learning, shifts, and so forth. Another possibility, if you are short of classroom space, I kind of hesitate to say this in our climate, but there's also possibility of outdoor. That, of course, has its own challenges with heat. We're going into rainy season. Will be rainy season in September. So that in of itself may have challenges. Again, I don't know your facility. There may be some covered area where this could be a possibility, so you can house some additional children. So you really need to look at your facility, and I would strongly encourage you, if you feel that you're not sure or you're not going to be able to meet health and educational needs, to request assistance from the health authority in your country to come and have a look and to advise you. Over.
Very much, Dr. Vasson. One last question I think we're going to take, because we are running out of time, has to do with the school librarian staff. I think this came about what to do with the school library and how can the school librarian fit into this whole discussion.
Okay, so the school librarian, in terms of the school librarian is part of the school community. And so the school librarian will have to be part of the discussions. Remember when I spoke about the different parts of the school, your gym and so forth, that I didn't say library, but library is included. If children come into the library for certain activities, again, you need to look at that facility. You have to maintain the physical distance in there as well. So it may be, I know some libraries have certain areas where students can congregate to do projects and so forth. It may be that you will not be able to maintain that part of the library in the same way. You will have to consider, how do you maintain the physical distancing with a number of children there? How many children can you accommodate in the library to do so? As you would think about touching books and so forth, hand washing, very important. At the entrance of the library, hand washing and no touching of eyes, nose, and mouth when you go in, so that you're coming in with clean hands, you're touching things with clean hands, and so you're not leaving contaminated environments. So certainly your hand washing facilities or sanitizer or something at the entrance of the library, maybe even sanitize inside. So if somebody realizes, oh gosh, I touched my face, they come and they sanitize before they continue. You may be required as a librarian to do a bit more monitoring of what you're seeing happening in the library while children are at work there. So the librarian is very important to be part of the conversation to make sure that that library environment and everything contained in it is also maintained in the while keeping the risk as low as possible. Over.
Thank you very much, Dr. Busson. I think we have covered some of the main points, but unfortunately our time is running out as I see more questions coming in. But I unfortunately have to hand over to our moderator, Dr. Malcolm, because we have to look at some of the closing remarks. As we mentioned before, the recording of this session will be made available to you once you put your contact details in the chat. So we'll make sure to send it out to you, and we'll also send you copies of the presentation. So with that, Dr. Malcolm, I'm handing back over to you. Over.
Thank you, Ms. Taylor, for moderating the session, and thanks for all those questions. I will now hand over to Ms. Caroline Brathwaite, Mental Health Planner with the Mental Health Unit, Ministry of Health, Trinidad and Tobago. Over to you, Ms. Brathwaite.
Good afternoon, everyone. Okay, so I will just be recapping what we would have witnessed and listened to for the past 2 hours. All right, so we want to thank, firstly, Dr. Wheeler for bringing welcome remarks to us. Dr. Eldona Boisson, she would have shared with us some of the things that we want to consider as we prepare to reopen in September, and of course, for whenever the other regions may be opening schools. The things that are of major concern are the children's education and development, and the risk of transmission, and of course, the mental health and psychosocial well-being of kids and teachers and all the parts of the school population, the school community. It is important to be aware of coronaviruses, to be aware of what is COVID-19, how it is spread, and how we can protect ourselves. She would have reminded us of the advice given by the Ministries of Health as it relates to hygiene and hand washing practices. We understand that the virus is fragile, so these measures are effective in reducing risk of transmission. She would have shared with us several practical considerations and suggestions to be implemented in the school population to reduce the risk of transmission. It is important to consider risk assessment of the students and staff, as well as the school facility itself. What we want to be able to focus on is matching interventions to the level of risk. That is the main focus when we're considering implementation of interventions. So we want to look at things like hygiene, and we are fully aware of some of the hygiene practices. Environmental cleaning, we're looking at both cleaning and disinfecting. We're looking also at physical distancing, what that means, at least 1 meter apart. And of course, we have to consider that in the context of our school environment, the actual facility that we'll be working in. She would have also made suggestions for managing the numbers in the classroom. We want to reduce numbers. So she suggested things like shift systems, separating the desks, etc. Also blended education, a combination of online and face-to-face classes, depending on the access of resources in your school community. Again, the aim is to limit exposure, risk of exposure. It is important to consider how we manage ill persons. So some students or teachers may come into the classroom or come into the school without symptoms, but may develop symptoms. So we have to consider what protocol or what procedures we can implement in the school to address this issue. So where are these persons going to be isolated? How are we going to access care for them, etc.? The use of masks were discussed at length. It's important that communication continues. The only way that we're going to get some kind of considerable change is if persons buy in to these interventions. So it's important to continuously and routinely update students, teachers, staff, and all the different persons who are involved in the school community. They need to be fully aware of what's happening, why it's happening, and how it can help them as well. Some additional information she shared. We want to avoid lapsing on immunization checks. Something that we can encourage is home study and projects, of course, depending on your students and their access to resources. We want to ensure that there's frequent follow-up and support for students, particularly students who may be marginalized. We need to also consider the other, outside of the teaching staff, social services, health nurses, school health nurses. We need to make sure that our interventions also link with this so that we can continue to care for our students who may need these services. Radio and TV broadcasting of lessons is another suggestion. And finally, she would have spoken to us about monitoring and evaluating these interventions. We want to look at things like school absenteeism rates of both students and staff. We want to look at class performance. Are these interventions improving the education or improving the performance of students or not? And we also want to pay attention to the health and well-being of both students and staff and all the other persons involved in the community. Another good way of getting information about these things is getting feedback, talking to the students, talking to the teachers, and asking them for feedback. So that was Dr. Boisson. Moving on to Dr. Claudina Cayetano, who would have spoken to us about building mental health and literacy in schools. She mentioned that mental health literacy is the foundation for promoting well-being and preventing mental disorders. We understand that 50% of mental illness symptoms may develop before the age of 15 and 75% by the age of 20. So the adolescent developmental phase of development is very significant. While we're considering reopening schools, the goal is not reopening to return to normal, but we want to reopen and do things safely. It is important to prioritize marginalized students, or students who are most at risk of being left behind. So mental health in school, we want to focus on both learning as well as the well-being and protection of students. She would have made mention to the UNICEF framework for reopening schools. That is a resource that we can all look at as we consider reopening of schools in September. Things that we need to consider, we need to gather critical information, and I believe there was a question about that in the comments. The mental health of the students is what we want to consider. So we want to take into consideration that, yes, there are several risk factors that these students may be exposed to just by virtue of them being adolescents, as well as other factors now that we are in this COVID situation. Some effective interventions, we want to focus on both promoting well-being and preventing disorders. So things like alcohol abuse, we're looking at things like suicide and depression. Depression is the 9th leading cause of illness and disability in this population, and suicide is the 3rd leading cause of death in this population, in this adolescent population. So really looking at what are the risk factors associated with this developmental stage is of critical importance as we reopen schools, because the mental health is now something that we need to be considering as they are back in the school system. What is mental health literacy? It is a program that upskills both students and staff, as well as non-teaching staff, about early identification of mental disorders and how to treat with it in the school population. Specifically, students and staff will learn skills in obtaining and maintaining good mental health. They will learn to understand and identify mental disorders, focus on a decrease in stigmatization, and they will also learn how to enhance health-seeking efficacy. Of note, teachers are not being asked to diagnose or to treat students or to provide counseling or therapy, but what they're going to learn is how to recognize signs, early warning signs, so that students and staff can access early treatment. What the teachers are being asked to do is to support students and refer appropriately. The MHCAP is an intervention guide that she ended with for non-specialized health workers like nurses, primary care physicians, that can help them build capacity to refer appropriately to identify mental health disorders or mental health symptoms in this population as they enter their offices. And we ended with Mr. Fiaz Shah from UNICEF, who would have shared with us a little.
We're not hearing you anymore.
Are you hearing me now? Can you hear me?
I think we have lost Ms. Brathwaite. And based on the time.
Can you hear me now?
We are hearing her.
Can you hear me?
Yes, I'm hearing you.
No, we're not hearing you. All right, so based on the time, I would like to wrap up. So thank you, Ms. Brathwaite, for providing the great summary and for highlighting those key takeaway points. I would like to thank the two presenters, Dr. Boisson and Dr. Cayetano, for their excellent presentations. Mr. Shah for speaking on the efforts of UNICEF, and to all of you for your participation. We hope that your questions were answered, and for those that we were not able to answer due to the time, we will send a response when we email the recording and the presentation. I hope you are feeling better, prepared to organize and to put the appropriate measures in place for the reopening of your schools in your respective country. We hope you will participate in future webinars and encourage others to participate as well. The next webinar is scheduled for Friday, the 12th of June at 2 p.m. And the focus of that webinar will be on coping with the stressors associated with COVID-19, specifically targeting young people and their parents. We will share the invitation with the link to join that webinar, and we're asking you to distribute it among your network based on the target. You can find additional resources on the PAHO, WHO, and UNICEF websites and on our social media platforms, including frequently asked questions. This brings us to the end of the webinar. So thank you all for joining us. Have a good afternoon and a great weekend. Over and out.